I'm Becky Palmer, and I'm going to talk today a little bit about how to help you make some determinations once you have the risk assessment for the youth that's been evaluated. First of all, don't panic. Here's the good news. The good news is that the current research tells us that the base rate for recidivism for youth who've committed sexual offenses is really low, and that most adolescents who do commit sexual offenses, rarely does that behavior follow them on into adulthood. And thirdly, youth who do reoffend often do not reoffend with a sexual offense, but with some other law that they've broken. Now, while all of this is encouraging for us, we still have to be aware of what some of the needs are for the youth and his or her family. While all sexual offending behavior is damaging and hurtful to victims, it is really important for us to understand what level of risk the youth still might present. There is a really small subset of adolescents who, with considerable or have a persistent risk to reoffend, but that is really the exception rather than the norm. So here's what I think it's important for you to pay attention to is that if you are not going to be seeing this youth in treatment, or maybe you are, but you also want them to have some sex offender specific treatment, here's some things that you can be paying attention to. First of all, at the end of this video, there will be an extensive list of resources for how you can find someone who might see this youth in treatment who has special expertise in working with youth who have committed sexual offenses, so that that's not all on your shoulders. Maybe you'll continue to see the family, and the youth will be seen by someone who has specific expertise. But what the research tells us is that the treatment that needs to happen is should be supportive of the youth who has engaged in sexual behavior. So the research suggests that effective treatment interventions are characterized by the following: that they focus on the dynamic risk factors, because that is supported by the current research, that the treatment intervention also is promoting safety while facilitating prosocial and developmentally appropriate skill development, that it is using evidence-based interventions that match presenting risk and needs, including the caregivers and positive supports in the treatment process is really important, so that you're not just sending the youth for treatment, but that the whole system is getting taken care of through the treatment interventions. That the approaches, now this information that I'm telling you is one, hopefully a way for you to be able to interview and talk with the person that you may be referring this youth to, because this is the resource that's going to be available to you, is the expertise of people who have worked with youth who have sexually offended. So treatment for adolescents who have engaged in sexually abusive behavior and in the juvenile justice involved populations, it's most effective when it's delivered in accordance with the evidence-based principles. So those are the questions that you're going to want to ask if you're referring this youth out. Is it evidence-based, and what treatment are they using? Is it multisystemic? Is it cognitive behavioral? Just a reminder that specific to treatment and interventions, risk informs the intensity of services as well as the level of structure and supervision. So if the risk assessment tells you that he's at low risk, you don't really want him being seen in sex offender specific treatment every day of the week, is an example. The treatment intervention also needs to ensure that treatment focuses on factors related to recidivism, the general as well as the sexual, and the individualized needs that are related to the adolescent's well-being. So one of the important factors in finding a professional who can help you with treatment for this child is that they are looking at the risk that the youth presents, the needs that the youth has in terms of the factors that are related to the recidivism, and then the responsivity, so that it supports the use of cognitive behavioral techniques and adjusting them as needed for the youth. So those are questions that you can directly ask when you're making a referral. Also, for the use of finding someone, many states now have what's called a sex offender management board. You can find those in your state online. Simply type your state name and sex offender management board or something to that effect if you've heard of that. And often they will have a list of referrals, or at least persons who are certified in providing treatment for youth who have committed sexual offenses. Your other option too is the person who has done the risk assessment may also have names of people and contact information for people who can provide the specific treatment for this youth. The bottom line is don't panic, and know that the youth is going to be taken care of. And if the youth has a relationship with you, you may want to consider that you will continue to have contact with the youth, and that would be one of the questions that you ask the person that you're referring them to. Will they be willing to share information as you maybe continue to see the family? Or will they do the group treatment and you can do the individual? But those are questions that you can ask the referring agent. Take a look at the resource material at the end of this video, and hopefully that will be something that will help guide and direct you through this process. Thank you.